school participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And today I am with Dr. Carol Wallman. Hello, Carol.
Hello.
So nice to have you here.
Thank you. It's great to be here.
Here at Gold, what we do here is we chat a little bit with our presenters, and you, Carol, you will be presenting for our Gold Neonatal online conference, right? Correct?
That is correct.
Wonderful. So before we get started about what topic you're presenting on and diving a little bit into the topic itself, tell our listeners a little bit about yourself and where are you located?
Yes, so I am a neonatal nurse practitioner and I am located out of Denver, Colorado.
Wonderful. Denver, Colorado. Yeah, now we have May. How is the weather in May in Denver, Colorado? What is it like?
Well, in May, the weather can be anything from snow, which we had
Mm.
last week, to 79 degrees and sunny, which we have today. So in Colorado, you never know. It
Y-
changes just like our moods.
So are you up in the mountains then?
I am not. We are along what we call the Front Range, so
Ah,
I have a beautiful view of the mountains, but it's flat
nice.
where we are. Uh,
Okay.
yeah. And
Wonderful.
I'm,
Well, yeah, go ahead.
oh, I was just going to say, as a neonatal nurse practitioner, currently I work as an assistant professor at Regis University and
Hmm.
coordinate the neonatal nurse practitioner program.
Wonderful. And then since we are at what you're doing professionally, can you tell us a little bit about your background and your professional journey? How did you get where you are today?
Sure, I have always loved babies and only ever worked in the neonatal field. I have never been a nurse for adults, with the exception of working with the moms of babies who are either sick or premature. And that's my passion. I feel like it's my calling. And within that, I've worked at various types of nurseries, well baby nurseries, community, graduate nurseries, and then high level intensive care nurseries, as well as doing neonatal transport, which is where you take babies from a smaller community hospital and bring them to a larger metropolitan center. And then within that time, I've always been passionate about serving women and their neonates where there's been a substance use disorder.
Mhm.
And so I have had a particular interest in that. And turns out that within the state of Colorado, being one of the first to legalize marijuana, it was just a natural fit to really spend time understanding that and the impact of that.
The impact of
I've
that.
also always loved teaching, and so that's how I ended up at the university now teaching neonatal nurse practitioner students primarily.
Wonderful, wonderful. So that's wonderful. You actually worked with families in the NICU and with babies and the families, but now you're also teaching nurses as well.
Correct, I am. And it's been a wonderful career. I feel like giving back to nurses that want to be nurse practitioners now is just a logical step in my career.
Beautiful. Thank you for sharing that with us.
Great.
Now let's talk. You mentioned your special interest is substance use. Babies with. Tell us a little bit about that. How did that happen? How did that come to pass that you got into that? And tell us a little more.
Yeah, in a way, it was just by chance. And you think about it back in your career as you reflect on times that were especially meaningful. And I remember being a new neonatal nurse practitioner working in a community hospital and being called down to the emergency room for a premature neonate that was born at home to a mother with a significant substance use disorder. And that baby was actually born in a bathtub at home. And just the impact that had on me trying to understand where the mother was in her own personal and health journey, and then the impact that that was having on the neonate. And it was so profound and an area that many of us are just so uncomfortable with, and it's a lot to understand. And so I just found myself delving into that situation, understanding it, and then throughout my career, I kept being drawn to that and opportunities would open up, and that over the time it just felt like that became an area of expertise that was needed, and I remained passionate about it and it was rewarding. So that's kind of my history with that.
Right, absolutely. And I can only imagine now with the opioid crisis that your knowledge was very, very valuable or is very valuable as well, correct?
Absolutely. The opioid crisis and the legalization of marijuana and just the whole impact that both of those have had on our vulnerable neonatal population.
Yeah,
And so I've been involved significantly on a local and statewide level, and as well as speaking nationally on the topic. It's been a very significant area where people are interested and have a desire and a need to learn.
absolutely. And now speaking of the legalization of marijuana, as you mentioned, Colorado is one of the first states, and others are either, in the process or showing interest, or other countries as well, not just in the United States. And I feel like it is, and correct me if I'm wrong, and you are the expert in that field, it's really hard to get to the bottom of good evidence-based or any research at all, because we get everything from, oh, marijuana is completely harmless, no big deal, to, oh, marijuana can really change the brain in teenagers, and everything in between. What do you say to that?
Well, I say that a lot of that is true, is that it is hard to get real solid evidence, and there are reasons for that. Barriers in research. If, for one, you think about the vulnerable patient as the fetus would be, and the difficulty of getting really good research where you want to randomize, blinded study,
Hmm.
but you don't have the ability to do that type of study with a pregnant woman. You can't say to the mom, here, you use this substance regularly that we don't know whether or not it's going to impact
Right.
your fetus,
Hmm.
and the other one not to. So it's really hard to get those studies. So we have to use the information that we have,
Right.
and a lot of those are retrospective studies. But we are gathering information, and,
Hmm.
and we're starting to get more information specifically about the presence of marijuana in breast milk, how long it lasts there,
Right.
and that type of information. So we are getting that information,
Hmm.
and you're right, we do have information on the impact of marijuana on the adolescent brain, and I often think it just seems logical to look back and think about the fetal brain
Right.
developing
Right.
in an even more vulnerable, earlier phase of development. And if marijuana does impact the adolescent brain, it doesn't seem that it would be a difficult jump
Hmm.
to assume that it has an impact on the fetal slash neonatal brain as well. So I think just being aware of that and understanding it, uh, in the context of it being a now legal substance,
Right.
does legal absolutely mean safe?
Safe.
And I think that's what we really have to step back and look at as individuals and as a society, for which population is it safe for?
Right. And it also, what I think makes it a little bit more complicated too, because marijuana is not just for use for recreational use, in use for recreational use, but also medicinal use, right? And has been attributed for any having benefits for with regards to epilepsy or even nausea in pregnancy. So I think that's also making it more complicated or complex, correct? Because it's not just a street drug, so to speak, but also it's been used in some cultures for medicinal purposes as well as being now legalized in some states for that purpose.
Correct. There are some medicinal purposes that are coming to light. However, within the United States, the FDA hasn't approved
Mm.
true THC, which is the psychoactive component of marijuana, for use during pregnancy in any
Hmm.
manner. So many people do say that they're using it with a medical indication, but that really hasn't been through the FDA or through the medical community. So yes, we are seeing a lot of different information between local communities and people that sell, the bud tenders, those that
Right.
sell the marijuana, and the medical and nursing establishment that is trying to make their decisions based on traditional evidence. So there's a culture clash, if you
Yeah.
will, with that.
Yeah, I can imagine. Now let's talk about the presentation. And you will be presenting on unintended consequences for our most vulnerable patients. Give us a little overview about your presentation.
Well, I want to talk about the complexities of the legalization of marijuana and how it has changed the perceptions within society, again, of it being legal, therefore being safe,
Hmm.
and how maybe we do need to step back and look at what that really means and look at the evidence that we are gaining, and the impact that that can have on the brain development, and evidence that we are obtaining about the use of marijuana during pregnancy and breastfeeding, not just the impact, but the frequency of use as well, and the perception of safety. So I just want to share what we know and then also share what we don't know, and share some tips about approaches to communicating with families where they are using marijuana during pregnancy and or breastfeeding. Some approaches that may be helpful for having those conversations. I've found that in the clinical setting, it's a very challenging
Hmm.
situation. People often bring pretty strong opinions one way or another to the table when those conversations are started, and thinking, how can we address this and still have a therapeutic relationship and a productive conversation about a topic that can be challenging
Hmm.
and can be somewhat divisive at times.
Absolutely. And I do believe we need knowledge. We need to learn more about what research is out there. What can we do? Um, and to communicate, right? Isn't that right? Also to communicate correctly or appropriately, rather, with our patients, also with other care professionals.
Right. I try to practice from the standpoint that it's extremely rare for a woman to make a choice knowingly that
Mhm.
will harm her
Right,
newborn.
right.
And so if you start with that basic playing field, if you will, or that type of approach, and sharing information and being willing to listen, I think that that can go a long way
Right.
in helping people make decisions that are are in their best interest based on the information that we have.
Mhm. So and then I'll let you go, the last question here for today. If you had to pick, let's say, one issue that you hope our delegates will take away from listening to this presentation, what would that be?
I think it would be that there is reason to be concerned that because marijuana has the active component of THC, which is a psychoactive um, drug, that there's reason to step back and truly assess whether or not it's the best choice to use that during pregnancy when the brain is in such a vulnerable and developing mode. And to really think about that and try to make a educated decision about that based on the best evidence that we have.
Well, thank you so much, Dr. Carol Wallman, to spend time with me here and answering some of my questions.
Well, it's been my pleasure, and I look forward to meeting all the delegates in June.
Thank you so much, and we are looking very much forward to your presentation. And now to our listeners, the presentation by Dr. Carol Wallman titled Legalization of Marijuana, Unintended Consequences for Our Most Vulnerable Patients will be live on June 17th. And for more information on this presentation and the other presentations in the conference, please visit goldneonatal.com. Thank you all for listening and thank you all. Bye bye.